doctors of Reddit, what is the weirdest thing a patient wouldn't admit? I'm not a doctor, but this happened to a friend of mine. My friend was in a very bad car accident. She was hit head-on by a huge pickup truck that was traveling 83 miles per hour in a 40 miles per hour zone. The driver lost consciousness behind the wheel. When the police arrived on the scene, my friend had a punctured lung and several broken ribs. The other driver was uninjured and was still passed out behind the wheel. Police found open containers of alcohol, marijuana and other illegal drugs in his car. He only woke up after the ambulance had already arrived at the hospital. When he was told that he had been drinking and driving, the doctors asked him if he remembered anything. He replied, "I probably passed out because of low blood sugar." Then they did a drug test and found that he had consumed whatever was in the car. I know it's late, but I'm a nurse and I had a patient, a man in his 50s, who was pooping even though he was wearing a diaper. When I asked him why, he said it was to freeze him. He ended up with a freezer full of pooped diapers in his garage. He also works as a housekeeper at the hospital. A few years ago, there was a child there about 16 to 17 years old. The kid seemed to have heard of a task that involves being able to put a light bulb completely in his mouth, but when he tries to pull it out, he can't open his jaws wide enough and the bulb breaks inside. And this is after 3 hours of forging the glass out of his mouth in every conceivable place, on his gums, under his tongue, on the roof of his mouth and in his throat. I asked him what happened, but he refused to admit that he had put the bulb in his mouth. His main argument was that his friend must have put the bulb in his mouth while he was sleeping and hit him on the jaw. However, when he talked to his friend in the other room, the friend admitted that he had tried to break the light bulb. The friend even showed me a video of others challenging him. So I went back to the patient and, taking the guardian, in this case his uncle and aunt, with me, explained to him the whole story about the light bulb without mentioning the friend. He asked what I was talking about. I explained and said that there were many videos on the internet with exactly the same content as the one I was talking about. I also told him that he had tried to perform dangerous stunts and tests before, but the stubborn bastard still refused to admit anything. He was adamant, claiming that he had absolutely nothing to do with his injuries and that everyone around him wanted to kill him. I'm just amazed at how arrogant and thick-skinned some people can be. They are willing to do anything to avoid doing something stupid and short-sighted. They are patients, not doctors. The doctor asked me when I last had a physical for gala and chlamydia, but didn't ask if I was sexually active. I am a virgin. My doctor was sympathetic, and for some reason I was embarrassed to admit that I was not sexually active, so he recommended a $250 plus urine test, which later came back negative. Looking back, I feel really stupid. My doctor didn't care about my sex life. I could have saved money. My story is that I'm actually a patient who didn't tell my doctor anything, but I felt it was good enough, natural enough, relevant enough to share. But when I was about 13 years old, I got a urinary tract infection. I ended up going to a children's hospital and had to do everything the doctors do to get the urinary tract infection checked out, treated. I didn't tell them and still haven't told anyone but my wife that it happened because I was wondering what it would be like to squirt water into my dick from a shampoo bottle in a hotel. But when you pump air in there, it makes a sound like a mini fart when it comes out. Hey, I was 13 years old and I used the high-pressure washer on top of the shower head to squirt water on my penis. It triggered the most intense orgasm I had ever experienced, and it lasted as long as I could contain it. Admittedly, I was a little uncomfortable with the blood in my urine. Usually people don't talk about it for fear of someone stupid trying it, but let's assume you have enough common sense not to. I'm not a doctor yet, but I was volunteering in the emergency room when a woman came in there with her pregnant daughter. Not only did she not believe her daughter was pregnant, but she was making her take laxatives to deal with her extra weight. It was really scary. I'm studying to be a veterinarian. I don't overfeed my dogs and cats. This is their normal size. There was a patient who came in with her boyfriend and the pet was like a watermelon. He was suffering from severe abdominal pain. According to him, it started when he started having difficulty coming down with feces. Tests showed that he had a ruptured colon, which was caused by using toys during sex. I think he introduced me to his boyfriend, so I don't see why he had to hide his sexuality. He's probably hiding the size of his bad dragon. I'm a dentist. I can't believe he would lie about flossing. One guy assured me he brushes his teeth twice a day, so he doesn't know why his teeth are falling out. I flared up. I gave him a mirror and showed him a pile of Clark at his gum line, scraping it off his teeth. I told him I wouldn't punish him if he suspected anything and that I would teach him how to brush his teeth, but he refused, saying it was impossible. Some people want to get dentures as soon as possible. A bit of a reverse situation. I had to go to the ER because I was dehydrated. I couldn't swallow anything and I was dehydrated. The doctor asked me if there was any chance of pregnancy, and I told her that I was sexually active, but I had just gotten my period, so it was unlikely. She looked at me and started laughing. Apparently no one ever admits to having sex and always tries to hide it for some reason. Anyway, it turned out I had a kidney infection. Laughs. I was hospitalized that year because I was 8 weeks pregnant and I was bleeding and in a lot of pain. I was worried about an ectopic pregnancy. I was asked about my chief complaint and I told them everything above, and in the same conversation when I was filling out the questionnaire, I was asked if I had recently had intercourse. I was very confused and wondered if they were just asking me about my concerns about an ectopic pregnancy. I started my residency class this week, and I've been posting about it for a while, but I'm posting here again now. It wasn't very clear at first, but after looking at her notes it became clearer. It happened during a psychiatry rotation in medical school, not a psychiatry residency. The psychiatric inpatient was a patient with suicidal ideation. She persistently claimed to have a mass in her chest and demanded that only a male physician examine her. When my psychiatrist refused to perform the physical exam, she demanded that I perform it during my daily patient interviews. I refused the physical exam as well, but on a hunch, I checked her medical records. It turned out that she had undergone an ultrasound the week before, which revealed only normal breast tissue with no masses. However, it appeared that the woman had repeatedly come to the clinic with various complaints of an unspecified nature, and when she saw a male physician, she usually presented with breast or vaginal complaints. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and Hisonic personality disorder. It seems her goal was to get medical attention. She had a lot of problems, but we also had to be careful not to catch her in a lawsuit. According to my psychiatrist, she didn't believe her health problems existed and her main goal was to get medical attention. If she really believed she was sick, she would have diagnosed her with an anxiety disorder known as hypochondria. I'm a radiologist. I've seen a lot of strange things here, but the strangest thing someone didn't recognize was a woman in trauma who had a panoramic scan because she had a lead. I saw gas and AI cubes in her vagina, but they didn't look like normal tampons. Upon reflection, I decided it could be a medication she was trying to hide or a strange foreign object. I advised the trauma team to investigate. They didn't want to do that, so I contacted the OB/GYN. They sent a first-year resident to ask the patient if she had anything in her vagina. The patient denied that she had anything. I then recommended a direct visual inspection, which after an hour revealed nothing. To this day, I have no doubt that she had a leprechaun in her vagina. TLDR, don't make freshmen do unpleasant things without clear instructions. He said he had maggots in his leg wound. A diabetic patient came into the clinic and said he had a wound on his leg. When asked when he had last seen it, he said it was in the morning. I helped him remove his socks and found a rather large ulcer on the side of his foot, which was being cleaned out by 4 maggots in a businesslike manner. I threw up a bit, removed the maggots and treated the wound, LVI therapy is really effective and we use it in the hospital. Medical students went to see patients in my clinic. The exams were done by volunteers. They were not given medical records, just a piece of paper with their name and chief complaint. When I entered the room, an elderly gentleman was holding a cup of coffee and didn't shake my hand. Then I noticed that one of his hands was severely weakened and wrinkled. I asked him about it and he said, "I'm all right now, you see," and moved his hand as if at a stroke. Now I was sweating. Cases like this are mostly an opportunity to talk to patients, and that should be easy, but this guy looked like he'd had a stroke and didn't know any better. In the end he was just messing with me, but I was so scared I decided to call a real doctor. A few days ago I got a call from the optician asking if I could get in to see an eye doctor as soon as possible. I told him there were no spots left and asked what the problem was. He said he had an eye infection and had not been able to see properly with his left eye for 4 days. He complained of profuse tearing and swollen eyelids, but didn't say that part of his vision had shifted in the last 4 days. We all have indicators, such as flashes and dark spots, by which we determine whether an emergency warrants urgent treatment in the ophthalmology department. I told him that he should go to the emergency room immediately. He replied that he was busy at work and was a supervisor. I told him again to go to the hospital as soon as possible and to take it seriously. He said he couldn't because it would ruin his day. I told him that he needs to stop putting work before his health and deal with it now. He still argues with me and says he doesn't feel like waiting hours in the emergency room. Anyway, if he has symptoms similar to retinal detachment, he can be seen almost immediately. I insisted that he should go, and he said he would go after the afternoon shift. He then asked me to tell him if it was urgent and what it was. I told him to hurry up and go to the hospital as I couldn't diagnose it over the phone. He said he would go and I'm sure he stuck to his plan to get it over with that same day. Retinal detachment can usually be treated if recognized early enough. I'm not a doctor, but I work in a large and busy hospital. An obese 18-year-old woman was admitted to the hospital complaining of severe abdominal pain. While she was being examined, it was discovered that she was going into labor. Note, my hospital does not have a labor and delivery room. The maternity hospital is on another campus a few kilometers away. This woman gave birth to a healthy 8B boy at ARA at full term, but denied her pregnancy and that the baby was hers. The placenta was still in the umbilical cord and had not been cut. The doctor said, "It's a boy," but she replied, "It's not my baby." Needless to say, a psychologist was called in along with a team from another hospital to take the baby to this hospital campus. I hope the child is doing well. I hope the mother puts him up for adoption and he goes to wonderful parents. But I have had patients who were clearly on drugs and categorically denied it. I am not a doctor, but I am a lab technician and regularly draw blood in the ICU. As I drew blood, patients would yell at me not to let the green men coming out of my hands touch them. As a result, even though they were given AG, the patients did not want to talk about anything for fear of their parents finding out. Patients lie about even the most mundane things. They say they don't smoke even though they smelled cigarettes, saw cigarettes in their wallets, or saw them smoking outside before they came to their appointments. But that's not what annoys me. What annoys me most is when patients Google what they believe to be their diagnosis, acknowledge that the diagnosis was correct, and then object to the recommended treatment and deny having read it. Another typical example is the bronchitis patient who Googled and read the Wikipedia article, but still came in and demanded antibiotics. As with almost any disease where the cure is conservative treatment, they still come in for a treatment for which there is no evidence. If you're going to be an internet expert, don't do 50% of the work and deny you haven't read the treatment part. I work in a pharmacy and it drives me crazy because so many people come in complaining that their doctor didn't prescribe antibiotics even though they don't need them. Too often antibiotics are prescribed to keep patients quiet, so this time the doctors did the right thing. He had to administer a drug test to a patient who came into the hospital with his pregnant girlfriend. After a few minutes he went to the restroom and came back with an empty cup. He returned to the room to get a drink of water and a few minutes later rushed back to the restroom with a noticeable bulge in his pants pocket. He returned with the appropriate sample. There he took a test, which came back negative. He then took a pregnancy test, which came back positive. Despite being told that a positive pregnancy test in urine can lead to prostate cancer, the man denied that the sample was given by his pregnant girlfriend. Unbelievable. I'm a doctor. I'm a doctor. It's also not surprising that some people are so crazy that they claim they were sexually infected with Lyme disease from their husbands, who were infected with Lyme disease from their mothers, and that this caused them to become infertile. If you don't know, that's unusual. What I found most odd was that people who were severely obese did not admit to eating only one small salad a day. In other words, unless you stuff 500 pounds of junk into yourself at a decent pace, it's impossible to gain weight to 500 pounds. Also, the snack wrapper was out of your pony's reach. I'm a medical coder, but for some reason I always laugh when I hear the word pony. I don't know why, but I think it's one of the funniest medical terms ever. The patient refuses to admit that he has drunk 2 glasses of water in a row, despite fluid restriction due to congestive heart failure. A rag is filled with water, placed on the forehead to cool it, the water is wrung out and poured over the face and into the mouth. Doctor, I don't understand why I'm not losing weight. It's the weight of the water. We haven't followed fat weight in heart failure patients. We find the weight at which heart function is optimal and we target that weight, but in a short period of 2 or 3 days, it has a big impact on the patient's water content. It's very strange. Are they doing it unconsciously? I'm not a doctor, but I am a nurse. One patient repeatedly contracted chlamydia by using a vibrator. We asked her about other partners and toys, but she denied it until she couldn't do anything else. CM cockroaches, Jolly Rancher anemia, squid masturbation, etc. Somehow we've fallen through the Reddit hole. God help me. Patient came in with abdominal pain. Exam is thorough, but some details are understandably omitted. If there's abdominal pain, the teeth are examined, if there's swelling, the balls are examined. My first thought was appendicitis. A few hours later, the patient's wife came to me and whispered, "I'm sorry." I looked and saw that his balls had swollen to the size of a grapefruit. It turned out that the patient had a hernia affecting the lymphatic vessels, resulting in a third interovarian space. The man was immediately taken to the operating room. I'm not a doctor, but I work in a hospital. I have a regular AA patient who comes to see me every day. She does this all the time because she knows that if a man complains of difficulty breathing or chest pain, she can't send him home before a doctor sees him. No one on the ward wants her to come in, and none of the doctors want to be responsible for her. She is very manipulative, mistreats the nurses and is very demanding. She is an opioid and benzoin addict, usually wants more drugs and wants someone to watch over her like she's at the Hilton. Every time, her goal is hospitalization. She succeeded a few days ago when she did some work on her own with her colostomy bag so she wouldn't be sent home. She dumped garbage into her four, trying to cause sepsis just to stay in the room. A man in his 20s came to the emergency room complaining of unbearable chest pain and looking very uncomfortable. He denied having an injury, but was found to have a fractured sternum. When I told him that I had found the cause of his pain, he replied, "Oh yes, I forgot." A patient was admitted with an inflamed ostomy. She refused to admit that she had used the orifice for intercourse. This is the second case in this thread. Literally, they probably can't afford the meds. We know for a fact that you were not on medication. Your life is at risk, and if you don't come clean, you could be removed from the transplant list for non-compliance. Saying you're poor is taboo. Light or drugs, food or drugs, gas or drugs. It sounds so simple, doctor, but I just couldn't afford it. But I am amazed at the number of patients who take Naren but have never used opiates. Nalen only works with opiates, not other types of drugs. Their breathing is shallow and infrequent, their pupils are pinpointed, and they may have needles, or pills in their pockets. They wake up when you knock and then deny everything. Denial is also a scary drug. The pills in their pockets never belong to them, sometimes they don't even belong in their pants. They went without pants, found pants in their size, didn't even check the pockets, ended up not using opiates, got narung, and for some reason the pants had an H. I was surprised. Another person came in with a bullet in his buttock, but he adamantly denied having a bullet in his buttock and was not injured. I am not a doctor, but I work in a radiology clinic. People always lie about fasting before their appointments. They come in for an abdominal ultrasound and say they didn't eat anything. In the urology department of the hospital for war veterans, someone complained of white discharge from the urine. After numerous examinations, the cause of the discharge could not be found, and after numerous consultations, the patient was hospitalized for urinary retention. It turned out that he had been pouring toothpaste down his urethra. The family member, not the doctor, is a psychiatrist, but he said he would never ask to change doctors, even if the patient didn't like the psychiatrist. In other words, it's about you. Doctors probably deal with dozens of worthless knuckleheads a day, so your request to change doctors isn't going to make their day much worse. Then, even better, tell them the truth. I once caught a patient's mother injecting poop into her son's vein. She, of course, denied that she and her son were famous in the hospital, so after gaining the trust of the nurses, she denied that she could have done such a thing. She was arrested and diagnosed with Munchausen syndrome by proxy. The poor child is alive, but has developmental problems. While working as a paramedic and EMT over the weekend at a local shooting club, a mute man shot himself in the foot while photographing the barrel of his 10-22 on the toe of his boot. He claimed he had been shot. I told him that the entry wound went right through the top of his boot and asked him where the shot came from. I need to call the police. Don't use bath salts. I had a patient with a corneal abrasion from crack in his eye, but he still had a crack pipe and claimed he didn't smoke crack. At 3 in the morning, I went into one patient's bathroom and BK found crack literally everywhere because he had been in the bathroom for a suspiciously long time. He stated he had no idea how it got in there and was as surprised as I was. I just turned around and went outside, called a violent cordon team to pour water on him, and an EVS team to scrub and sanitize the toilet. But all the while, he completely denied his guilt. Despite having to literally scrape the shit out of his fingernails and eyebrows, he never did. After calling the on-call doctor, the doctor scheduled a full one-on-one follow-up. For the next few weeks, someone had to watch him eat, sleep and poop. One mother brought in a 7-year-old child with pink fuzzy handcuffs on both arms. The mother kept saying she found them on the street, but the child angrily said, "I told you, I found them in mommy's room." The mom completely ignores him. If this is your first time on this channel, please subscribe to it. Until then, check us out as we post a new video every day.